Great. Thank you. So I am going to be sharing websites and different places that I utilize continually for folks with ALS. And want to let you know, do not scribble down all these websites. I want you to sit back and relax. At the very end, the last slide has my email address on it. You will be able to copy that down and ask me to send the all the links to you in an email. So this is where hopefully you go, okay, I can just sit back, relax, and enjoy learning. For some of you who don't know me, I am Mary Rebar. I'm the Care Services Coordinator for the Willamette Valley region. I've worked for the association since 2007, and I've covered King County in Washington State, other known as Seattle. I've covered the North Sound. I opened Alaska for the ALS Association, and now I'm here in the Willamette Valley. And it's not advancing. There we go. First place I want to start is on the ALS Association website. Lots of folks say, oh, I just don't know where to go and look these things up. So I want to show you how to get to the important places. So the first one we're going to be looking at here is our research. Excuse me, I'll show two places. Our research is going to be the second one I go into, but the first one will be local care services. So if you click on that, you are going to come to this page here. And I like this page because it lists over here all of our, all of the things that the ALS Association of Oregon offers. And then on the green bar going up and down, might look a little blue, but the green bar going up and down has multiple places you can click on to get more information. So if someone's newly diagnosed, they can click on newly diagnosed and they can go right into information for newly diagnosed. Or if it's familial ALS, they can go to familial ALS and click on that. The important thing to know is I'm going to focus on a couple of things today. And first, we're going to start with clinical research. So the clinical trial right in here. If you click on that clinical trial, then you will come to this page here. Yes, folks want to be involved in clinical trials. And to be honest, there are 110 research studies going on right now just with the ALS Association. I'm not going to be able to tell you who's open and who's not and what's going on and where it's being located. I'm going to call Carly Allen, or actually I'll have you reach out to Carly Allen, who's at the Northeast ALS Consortium, and she's going to be able to say, hey, you know, where would you like to go? Oregon? Maybe you have family in Illinois and would like to visit them and be in a research study back there. You could see if you can apply for that. You know, so it's a way that you can find what's open, what's going on. And so that is a great place to start for ALS clinical trials. The next area that I would look at is the resource area. And again, in that kind of blue-green bar going up and down, if you clicked on resources, this is my favorite resource that we have in the ALS Association. They're called Living with ALS Resource Guides. And they're broken down by subject. Okay? We used to give out a great big book, thick book, huge. Here's information you need to know. Well, if someone has limb onset ALS starting in their foot, they need different information than someone who's got pseudobulbar onset that's starting in their mouth region. So it's wonderful to have guides that specifically pinpoint what someone needs to know right now. So here, the first one that I use a lot is called Living with ALS 2, and it's after the diagnosis, Coping with the New Normal. So that's usually the first book that I give out. My second favorite book is over here, and it's called Managing Symptoms of ALS. Okay. So there are lots of little symptoms that can go along with ALS. But sometimes if you're working with your local primary care physician, he may not know that. And so being able to have a book that just addresses managing symptoms is important, such as one of the things in there is postnasal drip. Is that common with ALS? Constipation. Is that common in ALS? So being able to address some of the issues that can be coming up. Now, I'm just showing you my top 2. Please know, I think there are 13 guides. I don't know if you can see these, but here's functioning when mobility is affected by ALS, changes in speech and communication solutions. There's also speech and swallowing solution. And this one here is one written by Susan Pennock, our care services coordinator. It says supplemental instructions for end of life with ALS. So please know you can get these resource guides 2 ways. First one, click on the link. It's free to download. You can download it in e-reader form or to your computer. Or if you are a book person, a paper person, just ask your care services coordinator and they can forward that in the mail to you. But great resources, don't forget them. If you're an auditory or visual learner and prefer to watch videos, the ALS Association of Oregon has a YouTube channel. So if you clicked on YouTube, you would come to this first page here, and it's going to immediately start a video called What is ALS? And the next video that would come up is Signs and Symptoms of ALS. But I'm going to have you look at this area here, which says videos. If I clicked on videos, it's going to take us to this screen. This screen has all the videos that the ALS Association of Oregon has done in the past, I think, 5 years. So you are going to see this will be up on the video channel. Also in there will be presentations, a really great one by a gal named Dr. Riva, who did swallowing and food for ALS. One that I use all the time that's in here is also how to download an app to your smartphone or your tablet if you have bulbar ALS. So you can watch the video and learn how to do it. And then, so lots and lots of information there. Again, our research symposiums that happen each year will also be recorded. Last year was virtual, of course. But before that, we bring in multiple researchers to talk about ALS, and we would, of course, record those. So great information. Don't forget about this page here, especially if you're an auditory learner. Okay, so those are kind of the ALS Association of Oregon, kind of a couple of places, hidden little gems that we have. Now I'm going to jump to the World Wide Web and show you a couple of things that I use all the time. This is your ALS guide. This is a fantastic site to go to see or visualize equipment or to learn different words or ideas that are out there. Okay, when my loved one with ALS, when we went to our first clinic, I remember sitting in a room and the conversation was, okay, now that your ALS FRS is done, we're going to have an SLP come in to talk about AAC. What was that? So we had to say stop, use full words so that we could learn. So, and if you came to my house, we have jokes about Versarails because they told us at our first clinic, you need Versarails. Make sure you get Versarails. We all wrote, okay. If they would have said get toilet bars, we'd been like, oh yeah, that's a great idea. But we had no idea what Versarails were. So please know, you can go to this. You can look at equipment. You can see it. Like right now, I have the respiratory page pulled up. So you can see what a suction machine and a cough assist and non-invasive ventilation is. Also in here, they covered the different braces. So an example would be if someone sees you need an AFO or an ankle foot orthotic, you can go in and you can look at that equipment so you know what you're going to be talking to that occupational physical therapist about. So it's a great way. Or if someone says you need a neck brace, wow, there's a whole world of neck braces out there. Again, go into equipment, go into neck support, and you'll be able to see those things. A little nugget of information is Kim Hughes, who was the ALS Care Service Director in Arizona, helped start this website. And I think it's one of the great little gems out there. I'm going to jump back to research for a moment. So I hear all the time, I want to be involved in research. I want to be involved in research. Do you know you can be involved in research right from where you are sitting today? The biggest research study in the United States is the National ALS Registry and Repository. So what does that mean? The Center for Disease Control has a website where you can register, and once you register, you create your passcode, you get your own little entry portal to this registry. They have 18 modules in this registry. So what I'm telling you is you're not going to sit down and finish this in an hour. You're going to maybe make a coffee date with the ALS registry, and every Tuesday morning, sit down and do a module. And those modules, what's great is the first two are very intensive. They're going to ask you about your medical history, where you've lived, and then your family tree. After you get past that, you're going to go in what are called SMART surveys. So an example would be one of the modules is about smoking. And if you go in and you say, have you ever smoked? No, you're done with that module. Or the military one, have you ever served in the military? Yes. What branch, what dates? And they're going to go through things so that it's very, very in-depth. So those 18 modules you can fill out. The last module is, would you like to be involved in ongoing research? At that point, they'll ask you if you'd like to do it online through the registry, or if you'd like to do it in person, and how far you would like to travel. So some people may want to travel to Portland. Some people would say, I'd travel out of state. Once you put your information in there that's saying where you would like to do it, then you will be receiving updates to jump into the registry and fill out more information for research. Okay. The other thing is, this is ongoing. It's not like a one-time fill it out and be done. It will be emailing you like every 6 months to say, hey, here's some more information we're looking for. So jump back in and work on that. Okay. Once you're in the registry, you've done that, you will have the option, again from home, to be part of the repository. The repository is where they take your samples and place them at the Center of Disease Control. So the ALS registry at the Center for Disease Control pays a nurse to come to your home. Yep, I said it, your home, where you will donate to the repository. What do you donate? They clip your fingernails. They do a scratch on your skin. If you don't dye your hair, they clip your hair. They do a blood draw. They do a mouth swab. All that goes into a package, and it is not mailed. It is actually flown back to the Center for Disease Control. And then your little package is available for any researcher that would like to do more research. So you would be involved in national research and never have to leave your home. So a little thing on the repository, when they were first starting it off, they chose a couple of states to do it. And I spoke with Dr. King at the repository. And the great thing is, they wanted 10 samples from the state of Oregon to see how it would go, right? Shipping it all the way back and getting back there in a timely manner and be safe. And I'd like to just point out that 8 of the 10 that went on file all came from the Willamette Valley. Why? Because I'm passionate about this. This is the best way someone can be involved in research. And you can do it from your own home. Okay, next slide. We live in Oregon, so we're more on the healthier diet side, looking at naturopathic things. And we do have ALS research in the naturopathic way, and that is through ALS Untangled. So when you type in ALS Untangled, you're going to come up to this page here. You're going to see about our methods, completed reviews, and future reviews. In future reviews, you can click and vote on what you would like them to be studying. So it's an active review process. If you clicked on completed reviews, what you will get to is a rating scale. So you'll be able to see what are they studying. Curcumin is one that I've been asked a lot about lately, and you can learn about it 2 ways. You can see here that their rating system is there, key information. How does this rate? What do they think, the possibility of making a difference? And they're also going to tell you just a little bit about that study. So it's based on evidence presented in planning, and their curcumin was done in 90 milligrams twice a day in PALS. Okay. So you've got some basic overview, but the next one is you can click on that and you read the whole thing. But even better, you can click on it and have someone tell you over a podcast what that study is about. So I do want to say that you can go on the internet and you can put in Naturopathic Cures for ALS. And when my loved one had ALS 15 years ago, blue-green algae was the rage. Blue-green algae was going to cure ALS, specifically Klamath blue-green algae. After the study was done, it actually accelerates ALS. Oh my gosh. But guess what? You can still click on the internet and it says it cures. It cures, and you can buy the product from different places. So take that information when your friend says, this will cure you. Go to ALS Untangled, take a look around, see what they have to say about it. We talked about NEALS earlier, Northeast ALS Consortium. So it is called the Northeast ALS Consortium, but please know it covers the United States and Canada now. And this is a place where a lot of our research is, and a lot of webinars happen. So if you are looking for information, you go to NEALS, you put people with ALS and their caregivers. If you clicked on that, you'll get to a second page. And this page here will say, do you want to contact an ALS specialist? And it'll list all of the ALS certified centers in the United States. And then here you have the opportunity to click on webinars. I like it because these are actually the webinars that are training the doctors out there. So if you click on that, you'll get to this page here. And look, you can learn about BrainGate, the brain-computer interface system, new ALS nutritional apps, open label extension studies on AMX 035. One of the fun ones that I listened to is the key to stopping ALS being flushed down the toilet. And that's your biomes in your gut and how healthy are they. So a great place to go. I also like this because guess what? You can watch these anytime, and you could sit on your couch with your feet up and watch them with a cup of tea at night if you would like. So many, many different kinds of webinars available there. Under research again, the ALS Association has a program called Treat ALS. They have over 110 research studies going right now. Wow, 110. That's crazy. That's fantastically crazy, right? So please know, a lot is going on. So when someone says, hey, Mary, give me a lowdown on research, not really something I can do in 5 minutes, okay? There's a lot of information out there. So with the ALS Association here, you can, look at clinical trials again available. You can also look at research news and updates. But I put something on the very bottom because it is the Connecting ALS podcast. And this will give you a half an hour overview of what kind of research is going on. And so I think how they do it, if I remember correctly, is they release each week, and 3 of them will be on clinical research, and the others will be conversations and updates, like something about an ALS center or educational or something like that. So the podcast is great for me because I walk. That's my thing I do. And so I can, click on it and listen to it while I'm out for a walk or when I'm driving between home visits. So great option there. Now, the international group that is just like phenomenal is called the International Alliance of the ALS and MND Association. So MND means motor neuron disease. Remember that motor neuron disease has 4 diseases under it: ALS, PLS, bibrachial, and progressive muscular atrophy. So motor neuron disease is looking at all that. Here on our continent, we kind of roll it all together and call it the ALS Association, or Curing ALS. So here you go. Fantastic group. They also put all of their conferences online, so you can listen to the top international researchers talk about their research. And I do have to tell you, they're talking to other researchers, so sometimes it's going to go over my head. But the Allied Professionals Research Conference, phenomenal. I've had the opportunity to attend 3 times, and it is just absolutely fantastic. An example would be telemedicine being done in Australia for probably 20 years, and we just jumped into telemedicine in the pandemic time. So great ideas out there and fantastic information. So just remember that they're sometimes overlooked, and I think they're really good. Okay, I'm going to switch from research and the big research groups to one of the websites I utilize a lot. And ALS from Both Sides is written by a nurse named Diane Huberty. And she's been living with ALS for over 20 years. And I like the fact that she can talk in depth about the medical, but also talk about in your own home. What does it mean? What are the things to know? One of the things she talks about is adaptive clothing and what works for men and what works for women. So just lots of ideas there. And she can really explain it. Here, constipation is the one that is up here, but she's also got, women's options, toileting with a lift, all different kinds of things. So great place to go in and just hear kind of on both sides. She was a certified neurological nurse before she got ALS. So she's got a lot of great information she can share. Next one is within the ALS Association, one of the under the guides and manuals area or resources guides is emergency preparedness. And I bring this up because, oh my goodness, in Oregon, we've been through a lot, haven't we? Ice storms, then wildfires, and then again, ice storms this year. So being able to be prepared and ready to go if something happens, a go bag is sometimes what we call them, having the information that you need, like I don't even know what I would need if I went to the hospital. All the information is right here. The PDF form you can fill out on the computer and then print. Then there are little cards that you can print out or ask your care services for that you could have in that bag from point cards. There's also an app that you can download that can go on your phone. And I would suggest both the person living with ALS and the caregiver have it on their phone. because in a case of emergency, if a PALS is going off on a gurney to the emergency room, the PALS phone may be forgotten, or their glasses to read the phone may be forgotten. So it's important to know to have it on both the caregiver's, their spouse's phone, and the person living with ALS's phone. And yes, it is available in both Mac or iPhone and Android. So great resource there. Another resource I send out quite a bit is this, and this is Amy and Pals. Amy Roman has worked at Forbes Norris ALS Center of Excellence for over 20 years as a speech language pathologist, and she's got a great website. And the video on breath stacking is one of the ones I really like. So with ALS, you hear a lot about making sure your muscles are in range of motion and taking care of your muscles. Breath stacking is like that. It's like range of motion or exercise for your lungs to keep them healthy and elasticized. So this is there's a video at the very bottom of this, but she also gives the techniques written down so that folks can follow along and be able to do breath stacking. So a little one to tuck away, a little nugget for the future. The next one that I send out a lot and that I love is the ALS Association's new videos on breathing. I think they're only like maybe 2 months old as being released. And they talk about ALS and how it affects breathing in all different ways, like positioning and how does that affect breathing, dieting and how does that affect breathing. So all different things that affect breathing. It is a great series. They also interviewed one of our pals here from Oregon. Jeremy Van Tress opened his home and got interviewed about breathing in ALS. So if you watch these videos, you might recognize some of the folks in the videos because it is a lot of the staff members at the Providence ALS Center of Excellence. So shout out to them for being willing to jump in and make these videos that are available to everyone across the U.S. Okay. Oh, well, you get to see my screensaver too. I don't know how that happened. Another place that's a great resource is Team Gleason. Remember, Steve Gleason is a Northwest boy. He is from outside of Spokane area, and he has a love for the Northwest. So he offers grants to people with ALS. You see this? It says PALS resources. You would click on that, and then it would take you to this page here. And you can choose what resource you would like to start with. He offers adventures, but I think with COVID, there's no adventures being offered right now. The important ones to start with are two. One is home automation. What is that? Well, home automation is when a person is starting to lose the ability to do the switches on lamps, push that little black button back and forth, or do the deadbolt, which takes a lot of muscles, both fine and gross motor to do. You can apply for their home automation grant where they will send you a deadbolt that is easy to use. They will send you adapters so that your lights can be turned on by an app on your phone. And remember, those will come to you in a box. So then you want to make sure you have the ALS Oregon chapter grant because you can get reimbursed for the bill of whoever put those in for you. So great little connection there using two different grants and making it work. The other one to look at early is the voice and message banking, this one here. If you click on that, they'll help you get started on a program to message bank. They will even send you, if you need a microphone. Of course, you can also get the microphone through the ALS Association of Oregon. So they send it to you, you can start doing it. Now, I have many people who have received it and then got frustrated and started it or it didn't work, or they recorded 3 times and it didn't work. please know we have a safety net or a backup program for you. In the Willamette Valley, I started a program with the University of Oregon, and I work with a speech language pathology professor and 2 students each term who are available to virtually come into your home right now and help you set up the voice banking and make sure that there are no problems and walk you through it so that you can be successful in doing that. Again, if you're interested in that, you could email me and I would hook you up with that program or talk with any of your care services coordinators. As ALS progresses, there's a possibility of needing a power wheelchair. So under the mobility, you can get a grant that helps pay for the seat elevator on a power wheelchair. That is not covered by insurance. So the key is apply early through the Gleason Foundation before your power wheelchair is ordered, and the Gleason Foundation then works with either Quantum or with Permobile and sends the money directly to them to pay for that for you. Right next to it is the communication device. If someone is feeling like the copay on their communication device with insurance or Medicare is too much, they can help with a copay. Again, it's applying for the grant before the device is ordered. So please know, great place. Steve Gleason is Northwest boy, so he is very committed to serving people living with ALS here. Okay, I have talked for 30 minutes about all different kinds of places. I can tell you that after I put this together, I'm like, oh, I don't have ALS TDI and Project ALS and ALS, I am ALS. A whole bunch of folk didn't get in here just because of time. There are great groups out there, absolutely fantastic groups all of us working together to find the cause and cure for ALS. So please know, I could just do a whole slide presentation on what's available in Oregon. From access trails by the Forest Service to beach wheelchairs, all kinds of things that your care services coordinators can help you with. So please know, when you've got a question or hear about something, definitely reach out. Okay, so I would like to thank you today for listening in. Here is my email address that you can email me if you would like me to send you the links to, I don't know, what all 20 of those different ones that we talked about today. So please know that you can reach out to me and I'm more than willing to send it to you. Okay, so again, it is mary.rebar, R-E-B as in boy, A-R, at alsoregon.org.